nationally. You're not going to save the $54 billion that Senator Durbin alluded to and that yourself alluded to if you combine the direct savings with the indirect savings, because the price of practicing defensive medicine goes down. You probably save $150 billion a year. Now that's real money. So what we're saying, Mr. President, we're not talking about incrementalism. We're talking about, as Leader Boehner said, and Senator McConnell said, let's start over in the sense that we change the vision and work together to do the things that we agree upon, but do it in a way that doesn't destroy the fundamental market system that's made the American healthcare system the best in the world. And if we do that, we can make a deal.
Well,
thank you, Mr. President. Thank you, Leader Boehner.
Joe, I'll respond to you right at the end, because I think we should wrap it up. You're right. The proposal that John Boehner's put forward doesn't radically change the existing system. And that, I think, is why 3 million out of the 30 million who don't have coverage, or 40 million, don't get coverage. The proposal that's been put forward by the House and the Senate Democrats also doesn't radically change it, in the sense that the vast majority of people who currently have health care will still get it. It's just they'll see it a little cheaper. People who do not have coverage will start getting it. So it's not neither of these proposals are radical. The question is which one works best for the American people, and that's what we'll see if we can determine. We're running short on time. I know that some folks are going to, at some point, have to get going. I'm going to reserve the prerogative of making sure that everybody who has not had a chance to speak is allowed to speak. And then I will wrap up. That means that we're probably going to go a little bit later than we had anticipated, but as I said, by the standards of Washington, we're still in the ballpark here. I'm going to call on Charlie Rangel first. We'll go to one of our Republican colleagues. Patty Murray is going to have an opportunity to speak. Again, there may be some comments. There may be some other Republicans who are interested in speaking. We'll go to. We're going to actually go to Ron Wyden first. Then we're going to go to another Republican, and we're going to end with John Dingell, who was there when the idea of everybody having health care was first introduced by his father many decades ago.
Mr. President, why don't you just call on Republicans who haven't talked, because some of them have talked numerous times.
I agree, but I want to make sure that they may want to respond to whatever is said. Go ahead, Ron.
Thank you very much, Mr. President, and I think this has been a very constructive session. For the last 6 hours, we have essentially heard Republicans talk about incremental coverage and Democrats talk about comprehensive or broader kind of coverage. And I want to outline something that I think could bring both sides together for just a couple of minutes. First, on the incremental point, the evidence shows that incremental reform not only does less, it costs more. And the experts that both Democrats and Republicans rely on have found this. The Lewin Group, for example, that Republicans quote from, they say that, and both sides use them. Also, history. We have been doing incremental reform in this country since 1994. Since the blow-up of the Clinton plan, that's exactly what we've been doing. And costs have been gobbling up everything in sight, in the private sector and in the government. So I would submit that instead of this debate about incremental reform, comprehensive reform, we could all be for real reform. And real reform, in effect, changes the incentives that drive the system, and particularly empower the consumer. And Mr. President, I've been very pleased that you've constantly been coming back to the system for members of Congress. Folks, all of us can fire our insurance company, every one of us. And as far as I'm concerned, we've got to stay in this battle until everybody in the United States has that right to hold the insurance companies accountable and to fire them. And one of the promising points you made this afternoon, Mr. President, that I appreciate is the point on interstate shopping, because this is another opportunity, in my view, done properly to empower the consumer. Now, colleagues, our system, the one that we enjoy, already allows interstate competition for health insurance. That's the way the federal system works right now. And there are good consumer protections. So, Mr. President, when you made that offer to all of us today to work with us on this, not only am I going to follow up on what I think is a very gracious offer to try to bring both sides together, it allows us to build on the exchanges that we have today, which begin to empower people with more choices and competition. And if we just keep building on that, starting with this effort to bring both sides together on interstate competition, looking, in my view, at the federal employee system to do it, I think we can resolve a lot of our differences. So I appreciate the opportunity to speak, Mr. President. I want colleagues to know that I'm going to be following up with both sides of the aisle this afternoon in your administration to bring this group together.
Mr. President.
Yeah.
All of my members have had a chance to speak at least once, several of them a number of times. John Kyle reminds me that HSAs, for example, are not exactly for rich people, that the medium income of a user of a HSA is $69,000 a year. All of us are representatives of the American people, but I have a feeling we haven't been listening to them very carefully. Congressman Roscoe mentioned what the people in his district think, and I expect all of you are experts on what the people in your districts think. But we know from the polling that's been done in this country how the American people feel about this 2,700-page bill. We know how they feel about it. This is not a close call. If you average all of the polls in America,